Hello everybody and welcome to our dating show. We've got a great show ahead. As always, my name is Stephen Ashcan, student pharmacist at the University of Pittsburgh. Today we're going to be matching 3 contestants with 2 great drug therapies. Let's go meet our drugs. First we have lisinopril. And second we have ramipril. Alright, let's start getting to know our first medication of today. Medication 1, let us know a bit more about yourself.
Hello, I'm lisinopril. I'm an ACE inhibitor that works by decreasing angiotensin II by inhibiting angiotensin converting enzyme. This results in the relaxation of arteriolar smooth muscle, and that results in a decrease in blood pressure.
That's great, good to know. And what about you, medication 2? How do you work in the body?
Honestly, I do the same thing.
Wow, well that's great. All right, medication on the right. What do people complain about you in the past?
People that take me often complain about dry cough, fatigue, angioedema, and in some instances, I can cause liver damage.
All right, that's great. And anything else we should know?
If you're pregnant, do not take me.
That's great, okay. And medication 1?
Well, people who take me pretty much experience the same thing as the other contestant. I tend to cause headaches, nausea, dizziness, and cough. Just a tad bit more than the other contestant, but you know, hey, not everyone's perfect.
Nobody's perfect.
On the bright side, I rarely cause liver damage, but definitely do not take me if you're pregnant.
All right, let's move on to cost. Medication 2, how much do you retail for?
Well, 1.25 milligram capsule costs about $28 for a supply of 30 capsules.
Woof, that is pretty steep. All right, and medication 1?
Well, 2.5 milligram tablet costs about $16 for a supply of 30 tablets.
Oh, well, it seems like medication 2 costs quite a bit more than medication 1. That's a unit cost difference of $2 versus 70 cents. All right, let's see which one of these medications our contestants picked today. All right, we're going to start off with contestant number 1. She has heart failure and a history of liver problems, but don't let that fool you because her kidney function is excellent. Contestant number 1, do you have any questions for these medications?
Yes. Okay, so medication 1, what is your typical dose for a heart failure patient like me?
I usually start off as 5 milligrams by mouth every day with a diuretic. Then that's increased according to your tolerance to a max of 40 milligrams by mouth every day.
Cool. Same question for medication 2.
I start off as 1.25 to 2.5 milligrams by mouth every day, and then I'm titrated up to a max of 10 milligrams by mouth every day.
Okay, another thing that I do want to know is, does food affect you guys? Because I really like to take my medication with food, especially after dinner. I don't know if it's just a routine thing or what, but I don't like taking meds without food.
Doesn't matter to me. Whether you take me with food or not, I will be the same efficacy for you.
Well, technically you can take me with or without food, but realistically my rate of absorption decreases a little bit with food.
Interesting. Man, this is a tough one. I want to make sure that I pick the right one for my heart failure and with all the issues I've had with my liver.
Wait. I'm sorry. You might have mentioned this before, but did you just say you have liver issues?
Yes?
Oh man, I hate to break it to you, but I kind of rely on my liver. You see, I'm a pro-drug, so I require hepatic activation for my active form to, do its thing.
Well, I wish I would have known that earlier, but that definitely makes it easier for me to make my decision. Medication 1, I pick you.
All right, contestant 1, seems like you're going to be leaving tonight with a nice bottle of that sweet lisinopril. I hope that works out well for you too. All right. Okay, now let's bring out contestant 2. This guest is a guest with recent MI who's looking for something that doesn't have too many side effects, and he isn't the biggest fan of tablets either. What questions would you like to ask?
Just out of curiosity, what are your typical doses for MI patients like me?
Well, when I'm first given within 24 hours of the MI, it is 5 milligrams by mouth every day for 2 days, then 10 milligrams by mouth every day for at least 6 weeks.
I'm initially given as 2.5 milligrams by mouth twice daily, and then titrated up to 5 milligrams by mouth twice daily as tolerated.
Nice. Cool. Nice. Okay. So honestly, I don't like taking medications because of all the side effects I hear about. What kind of side effects do you both have?
Well, I don't really like talking about this aspect of my personality, but I can cause dry cough, dizziness, nausea, and headache.
Yeah, great.
Well, guess what? Although I can also cause those side effects, studies show that complaints about me are much less frequent than this other guy here.
Ooh, wow. So, the last thing I'm worried about is that, I have trouble swallowing tablets.
Well, I'm a tablet, so...
It's your lucky day. I'm one of the very few ACE inhibitors that actually come in capsule form, so you can put me all over that applesauce.
Oh my god, no way!
Okay, so before you make the obvious choice here, I just wanted to ask you a question. What's your liver function like?
Don't worry, babe. I have stellar liver function.
You won't have to worry about metabolizing me.
Alright, so I think the choice is obvious, but contestant 2, who do you pick?
I don't have to think twice. I pick medication 2.
Alright, contestant 2, it looks like that's going to mean you're going to be leaving tonight with a good bottle of Ramapril. Alright, and last but not least, we have contestant 3, who has essential hypertension and a creatinine clearance of 35 milliliters per minute. Alright, and contestant number 3, they also mentioned that their physician wants to prescribe a medication that doesn't require dose adjustment. Do you have any questions for these medications tonight?
Yeah, so what are common dosages for hypertensive patients like me?
I'm usually given 20 to 40 milligrams by mouth every day, and then I'm titrated up to a target dose of 40 milligrams by mouth every day.
For those not receiving a diuretic, I'm initially given as 2.5 milligrams by mouth every day, and then range from 2.5 to 20 milligrams by mouth every day or twice a day.
Cool, so I have a creatinine clearance of 35 milliliters per minute, and for some reason my physician doesn't want to change dosing, so is that going to be a problem for you guys?
Well, since your creatinine clearance is less than 40 milliliters per minute, I unfortunately would have to be administered at a reduced dose of 25%.
Well, in contrast, because your creatinine clearance is greater than 30 mLs per minute, there'd be no dose adjustment involved with me.
Oh, so that's nice. One other thing. I'm concerned about taking Tylenol with these drugs. I take it whenever I have a pain or fever. Is that going to be a problem?
I would have no problem with acetaminophen. However, if it were someone like ibuprofen, which is like Motrin or Advil, then there would be some issues because they reduce my antihypertensive effect.
Yeah, I'm exactly the same. No problem with Tylenol, but ibuprofen, or honestly NSAIDs in general, is a different story for the same reason. You see, they cause afferent arterial constriction while we cause efferent arterial dilation. Also, the combination of either one of us and an NSAID can lead to kidney damage.
Oh, that would not be good. Thanks for letting me know.
Alright, and contestant number 3, what does that mean you picked for tonight?
Alright, so with my creatinine clearance of 35 milliliters per minute, I don't want to deal with any dose adjustments, so I'm going to have to go with medication 1.
Alright, good choice, contestant 3. That means you're going to be leaving tonight with a great bottle of Pacifico. Hope it works out well for you too. Alright, and that's all for today's show. Tune in next week when we have 3 contestants picked between spironolactone and eplerenone. Wait, I'm pregnant and I was just diagnosed with hypertension. Can anyone help me?
No!
Bless America. Let's go, Mets.
Oh wait, hold on.
Dose for a hype.
Yeah, what are common...
Wait.
Wait, what?
Sorry, chair. I know it's a nice chair.
I I take it whenever. Okay, I can't.
Okay. So,
Okay.
wait, is it gonna be all of us or
Change
just
now,
us?
or-